Hello dear patients. Today we are going to discuss the case of testicular cancer, the cancer of right testicle. A young man came to see us. He came without any complaints. He came just for prophylactic observation. He quite recently had a sexual contact. This contact was quite normal and he came to do smears. Therefore, if you do smear, you pay for taking analysis and I observe the area where I take the smears from. I often explain that smears are taken not only from sexual organs, but from mouth and anus if necessary. In this young man, smear had to be taken only from urethra because he did not do cunnilingus and there was no penetration into his anus, roughly speaking. Therefore, we took smear from penis and observed his testicles, urethra, sexual organs, palpated his lymph nodes. I paid attention to the fact that his right testicle was different from the left one by the fact that it was slightly increased, not only on palpation but externally as well. You can see the picture showing that externally the testicle is almost normal. There was no inflammation and the main difference is the density of testicle. I noted the density of right testicle. In case of such symptoms and regardless of the patient's young age, the patient is a bit older than 20 years of age, it's necessary to think about oncology straight away. In case of such symptoms that I noted in 5 patients in my life, in 2 of them this was not oncology, and this is the 3rd patient in whom we found oncology later on. What needs to be prescribed? Analyses have to be prescribed. It's not enough to just touch the testicles. For sure, the testicles do not have to be lubricated with anything, as many dermatologists do, and not to prescribe anti-inflammatory suppositories, as those who like anal treatment do. It's necessary to do analysis at least for alfa-fetoprotein, beta-human chorionic gonadotropin, LDH, that is lactate dehydrogenase, and advisably testosterone. Such analyses have to be prescribed. I will shortly remind you of the symptoms that may be during testicular cancer. It can be asymptomatic, as in our particular case. It can be accompanied by different unpleasant sensations, pains in the area of testicle and in the area of pubis, etc. It can be accompanied by densifications, as in our particular case. It can be accompanied by swelling that the patient sees himself, by increase or decrease of testicular volume, by blood in urine and sperm, which is quite an unpleasant symptom. It can also be accompanied by pains in abdominal area and in area of testicle. All of these are quite common symptoms. However, our particular patient did not present with any complaints at all. His analyses were normal. However, it is important to insist on the patient having at least ultrasound study, and on ultrasound study we found a tumor. You may see it on the picture. There is a short video of this finding which answered all the questions. The analyses, however, were normal for all of the above listed indicators, and this indirectly suggests that the cancer is in its early stage. It is fit for surgery, and here there are good chances for survival of this patient after surgery. Therefore, the patients who do analysis on their own go to some laboratories for that. This is generally not right, as the analysis has to be taken by a doctor who observes the patient at the same time. Particularly in our clinic, you can go for analysis without paying for consultation, and together with taking the analysis I observe the patient. In my practice, this has saved at least 3 patients from oncology. They also did not have any symptoms, as in our case. Therefore, the taking of analysis by doctor is generally correct, as from the point of view of such marginal case as in our practice, and from the point of view that the doctor will correctly consult the patient about where these analyses should be taken from, whether it is necessary to take them from the surface of rashes, etc. So we did all what depended on us, and the prices for analysis in our clinic, at least for PCR analysis, are a bit lower than in laboratories of Moscow. Therefore, it does not have any economic component, and together with that, I wouldn't be scared to say it. It saves lives of patients, because if this particular patient gets his time of surgery delayed, then he can get metastases, etc. So in this particular case, by ultrasound data as well, I'm not going to dig into medicine now, we have not seen such signs. So if the patient has timely surgery, then he can save his life and probably may have children if the second testicle is healthy. By the way, there were no signs of oncology in it.